What is the state of America's health?
This is a really good question. We are living in a dual pandemic. Talking about the incidence of heart disease, the prevalence, the mortality that we've had from cardiac disease, that's been the number one killer of Americans since 1918, when we had another pandemic, the Spanish flu epidemic, that took it out. For 1 year, it was out as the number one cause. We have been struggling with this ever since. It has to do with our lifestyle. And never a finer point was put on it than to look at the data that says that it had, before COVID, heart disease had become the leading killer in most countries, the low and middle income countries, but the high income countries, had fallen to number 2, except the United States of America. So we could have all of the resources in the world and still have heart disease as a blight on this society. We have a situation where Medicare is going broke. It was supposed to actually become insolvent in 2026. It's now scheduled with COVID to become insolvent in 2024. And that's going to mean a large change in the way we redistribute resources, or large cuts. They've estimated 30% cuts to physician fees. That will make the system crash. And so the question that we have to answer is, what can we as individual Americans do about this? How much responsibility can we take for our own health, follow healthy principles and lifestyles that would cut our rates of disease and cut our healthcare expenditure? And we have a choice. We can go ahead and do, the way we've been doing our lives and continue to suffer, because this system that we have is really good at stopping people from dying. Stopping people from getting ill is still a problem. So we have a choice. We have a fork in the road. And that fork is either going to be a healthy plate or one that isn't.
How do we solve America's healthcare crisis?
The most important thing that we could do is look at all the data on lifestyle. This healthcare crisis is essentially a self-inflicted wound on the American people. Sure, there are diseases that are genetic. There are some that are environmental that we didn't know how to avoid, but there are many that are actually due to our active lifestyles that every day, the choices that we make. We get up in the morning and we decide that we're going to exercise or not, and how much and how. And we get up in the morning and we decide what we're going to eat. And if we just take a careful look at the health literature that supports plant-based nutrition, exercising daily, maintaining a healthy weight, not smoking, making sure that you know what your blood sugar, blood cholesterol, blood pressure are like. If we do all of these things, we can actually solve this healthcare crisis. One of the most striking graphs I've ever seen is the comparison of around the world, comparison of life expectancy versus healthcare expenditure. You've got to see this graph where all the countries are doing pretty well and spending much, much less than what we spend. The United States is sitting alone and in one part of the graph with massive expenditures and poor outcomes. Is it because we don't have good care? Certainly not. If you go on the Johns Hopkins website, take a look at the COVID numbers, which are right there for everyone to see. You can see the number of COVID cases in the United States is absolutely massive. And Western Europe is not doing so well either, but it's absolutely massive in the United States. And then you move over from the incidence of COVID to the case fatality rate, and you will be shocked that the case fatality rate in the United States is incredibly low compared to the rest of the world. So yeah, you're going to get COVID, highly likely at the United States, but dying from it, you better be in the United States if you want to survive it. Well, that's because we have an amazing healthcare system. So why don't we have the life expectancy? It's because there are so many choices that people make every day that are so detrimental to their health. And even living in the best situation, all the king's horses and all the king's men can't put people back together again. So I'm hoping that everyone will recognize that and make the choices that are going to be positive for them, for their family, their community, and the nation. And I think it's everyone's patriotic duty to do that.
What are your thoughts on this passage from Gary Taubes, author of The Case for Keto? The big difference between the physicians and researchers who admitted to using keto 20 years ago for temporary weight loss and those eating and prescribing keto today is that the latter now believe these diets are the healthiest way for them and their patients to eat. They don't worry about the saturated fat their patients will be eating because the clinical trials confirm this way of eating is beneficial, and they can see their patients and themselves getting healthier, often over the course of weeks or a few months. They are loath to recommend anything else. I've interviewed more than 120 of these physicians who tell me that they chose medicine as a career because they wanted to make their patients healthy, not to manage chronic disease. Getting their patients off carb-rich foods, at the very least, sugars, grains, and starches, and eating something akin to keto makes that happen. When public health authorities argue that a healthy diet for all means plants, they make the job of these physicians and the challenge to their patients that much harder. Again, what are your thoughts on that passage from Gary Taubes?
So let me take it in reverse order. So healthy diet, meaning mostly plants, I wasn't aware that we had that many effective public health authorities actually saying that. I mean, yes, we have guidelines from the American Heart Association, American College of Cardiology. We have the dietary guidelines for Americans. And we were hoping that there would be a large push towards plant-based nutrition. And maybe it's because I'm on the other side of what Gary Taubes is saying. I see it as very slow in terms of the uptake. Now, let me go back and deal with many of the things that he's actually said. And so one that everyone should hear from this passage and everyone should pay attention to is sugars. But when you say grains, you've got to separate the poison from the benefit, and that is refined grains, which are clearly detrimental to human health. And there was a wonderful article from the Pure Trials, which covers so many countries, around 21 countries. They published a while back that carbohydrates were bad for you, and fat was, particularly if it's unsaturated fat, was relatively good for you. Great. The problem with it, if you looked in their methods, they were talking about refined grains. We're talking white sugar, white rice, and white flour. And if you're talking about those kinds of grains, then yes, it is very detrimental to your health, as opposed to whole grains, where every trial that's looked at whole grains has shown a reduction in mortality. And that's really what we're talking about. So when we go back and talk about, what physicians are prescribing, I wish that would be a gold standard, but physicians are a product of their education and their environment, and the leading cause of death of physicians is still heart disease. And so even though we know pretty well how to avoid heart disease, we're still succumbing to it ourselves. And so the most important part of this discussion is that there are benefits to a keto diet. Those benefits are actually not detrimental to people long-term if they're doing it with plants. That was shown by an article published in 2018 in Lancet Public Health. And the rest of the literature is very clear that if you're doing a keto diet for any length of time, you are increasing your inflammatory markers and your cholesterol. And those outweigh the benefits of losing weight, decreasing the blood pressure some, decreasing diabetes a lot. Those benefits are outweighed and the mortality rate goes up. Now, each article that has looked at this, which is about 8 of them at this point, all of them saying the same thing, are very clear. It takes a while for doubling or tripling your LDL cholesterol, the bad cholesterol, to actually take its effect. And so people may feel better. They're actually going to feel more energetic when they lose the weight. They'll think that things are going really well while their arteries are being plugged with the LDL cholesterol. And so that is why the Greek study said it was 31%. The Japanese study said it was 22%. one in the Journal American Heart Association, in people who had prior heart attacks doing keto said 53% increase in death rate. And so this is not a diet that people should be doing for any long length of time. How long is it safe? I think most of us would say that if it's going to be detrimental, don't do it at all. But there may actually be a point at which you could sort of optimize between it, do all of this keto type of dieting for a month or two, lose some weight, get started, and then switch back to plant-based diet. The other way to do it is actually to do a plant-based keto diet, which has never been shown to be of harm. So I would say that the good point would be if we're going to have a conversation about refined grains, that's the one that I think pretty much everyone can agree on, no matter what your point of view is. These are things to be avoided, but eating animal products and saturated fat for long term will have negative health benefits.